Good afternoon, everyone. Can I start today by paying my personal respects and sympathy to the Smith family who have lost loved ones in a terrible accident within my own constituency in Ballycastle. The death toll from COVID-19 has been falling in Northern Ireland. Today there are another 2 lives which have been lost. But we always have to remember that one death is one too many. Each case is not a statistic, but a life cut short and a tragedy for loved ones. My thoughts are very much with the families and friends of those who have so sadly died. We have so much more to do as we continue this fight back against COVID-19. Progress is being made, but it has been hard won and could be quickly lost. Let's acknowledge the fact that social distancing has saved a great many lives. This is something we have achieved as a society, curtailing our lives and our freedoms in a drastic way. That sacrifice was worth it and continues to be worth it. As we think of the continuing death toll, we know it is right to move forward cautiously and gradually. I warned last week that we must not get ahead of ourselves, and I very much welcome the fact that the Executive has adopted a phased approach and is being upfront about the uncertainties that are inevitably involved. Today, I can provide an update on our critical care surge plan, because with the number of COVID-19 patients requiring critical care maintaining a gradual downward trend, my department has taken the important decision to reduce the escalation level for critical care to low surge. The system will retain sufficient additional beds to continue to deliver care for COVID-19 positive patients in the coming month. But as a part of this, the Nightingale at Belfast City Hospital will be temporarily stood down. Although it will continue to be part of the region's flexible plan to re-escalate if modelling suggests a second wave. COVID-19 has had a severe impact on many local services, so I want to ensure that we get back to delivering as many services as quickly as possible. And I would like to take this opportunity once again to remind all those listening that much of the day-to-day business of the health service does still continue. If you suspect you need medical care, please do not hesitate in coming forward. Today's important decision will allow the reintroduction of urgent surgery and the range of other key services to be delivered from the tower block. This is a welcome development and has only been made possible by the expertise and the commitment of HSC staff and the public's steadfast compliance with social distancing. So my heartfelt thanks go out to you all. But of course, care homes remain the front line and an absolute priority. As I've made clear, one death is one too many. It is a tragedy that COVID-19 has claimed the lives of older citizens in nursing and residential homes. This cruel virus targets the most frail and vulnerable members of our society, and care homes in many countries have been seriously impacted. This impact, like the virus itself, has not respected borders. Our colleagues in the Republic and across the United Kingdom have had similar distressing experiences. I want to emphasise again that extensive support has been and is continuing to be provided to the care home sector. We will always be looking to do more. I can today detail 3 key areas of work. Firstly, I absolutely recognise the important role that testing has played. And based on returns from our QIA for the 12th of May, with 94% of homes completing that, 3,346 residents in our care homes have been tested to date, and that's around 25% of the total care home population. Similarly, 3,632 staff have also been tested. We are now testing more residents and staff and more people generally per head of population than any other part of the United Kingdom. And there will always be further significant expansion of testing for care home residents and staff. This expansion will be informed by advice being prepared for government and the NHS by SAGE and my department's Strategic Intelligence Group. Ahead of that, the Northern Ireland Ambulance Service is now providing a mobile testing service for care homes, working in conjunction with the Trust, the PHA and board teams, and in addition, up to 40 nurses from the HSC have been deployed to support testing in care homes, and additional testing has also been extended into supported living environments. Further significant expansion will occur, guided by the experts of SAGE. Secondly, intensive support is being provided for care homes, including strengthening by trusts of the hospital to community outreach teams. Outreach teams deliver specialist care and support to older people, working in partnership with GPs, district nurses, allied health professionals and social care colleagues. This can facilitate vital initiatives such as virtual ward rounds. Support for the care home sector to date has included producing an updated guidance to homes, £6.5 million in additional financial support for the sector, providing millions of items of PPE and thousands of staff hours to care homes free of charge. Further financial support for care homes is under active consideration. The third key area is reform and investment of social care, which I will be presenting to the Executive very shortly, which will chart a way ahead for this vital sector, including, as an immediate priority, additional support for staff. I want to again thank care home staff for all the work they are doing. The social care sector has been struggling for years and as a whole is not fit for purpose. The reasons for this are well documented and are no fault of the staff. It is beyond doubt that the sector needs much greater capacity and resilience. This is essential given the threat that will be posed by COVID-19 in the months and potentially years ahead. I am therefore proposing to move ahead with reform and investment plans, subject to the necessary financial support being provided by the Executive. I want to see training and terms and conditions for care home staff being standardised and improved. We will have to ensure that the return of this investment will be to the benefit of staff and residents, and not for the profit margins of the operators. That means a decent wage, access to some form of sick pay, a career pathway and training. I accept that some of the providers already provide this, but in the future all will be required to. Social care was in a crisis long before this pandemic reached our shores. Making sure that doesn't happen again should be a priority for us all. I'll now hand over to the Chief Medical Officer, Dr. Michael McBride.
Thank you, Minister. Can I also start this afternoon by extending my deepest sympathies to all of those who have lost loved ones, for all of those who continue to receive treatment and care, whether it's in our hospitals, whether it's in our care home sector, or whether those that are at home. I want to emphasise that the news that the Minister has announced today regarding the de-escalation of the Nightingale Hospital is significant. It underlines the importance of social distancing measures that have been in place for many weeks now. There were widespread fears not that long ago that our health service, as elsewhere, would be totally overwhelmed by COVID-19. The people of Northern Ireland, our great health and social care staff, have fought back hard against that threat and continue to do so day and daily in a range of settings. The threat of our health service being overwhelmed was real. Make no mistake about that. It posed a particular danger for our senior citizens and those with significant and severe underlying health conditions. We had all seen the reports in other parts of Europe and in other countries of the challenges that their healthcare systems faced. So protecting senior citizens, those at increased risk, have been at the heart of everything we have done from the outset. I want to speak particularly to our young people and to all of you. Thousands and thousands of young people have put their lives on hold to keep their grandparents and others safe. I want to acknowledge that, and I want to say thank you for that. So let us all acknowledge that. The people of Northern Ireland of all ages have, for now, changed the course of this virus. They have stayed at home, they have saved lives, and they have protected the NHS. So let's not any of us forget that. As the Minister has said, there is a very long way to go. As the Minister warned at the very outset of this pandemic, complacency remains our greatest enemy, and we have to be on the guard for further waves of infection. We have to move forward cautiously and take a phased approach to the regulations that are in place. And that is exactly what the Executive is doing. There is no point offering people false hope with dates in the calendar that would be entirely provisional and subject to alteration. This virus doesn't read our plans, and this virus doesn't keep to our timetable. And that's why it is vitally important, as the Executive has agreed, that we take a careful and cautious approach to any future changes that we make. The situation is extremely fragile. Yes, we must work for the future, but always be mindful of exactly where we are and remember where we have been. Now, while the escalation level for critical care hospital services is now at low surge, as the Minister has said, we are seeing ongoing challenges in our care sector. We have to be ready to scale back up the surge capacity in critical care if that is what's required. But it is absolutely vital now that we start to re-engage other health and care services with a focus on stepping up any urgent services which were paused during the response to the first COVID-19 surge. Reducing the escalation level will ensure that the health and social care system has the capability to release and redeploy some capacity to enable the resumption of urgent surgery and treatment. But I would also need to urge and advise that we also have to undertake that gradually and cautiously. And Minister will have much more to say about that in the near future. The Minister has also indicated that we will have further details of significant expansion in care home testing, building on that is already underway, as informed by the best available scientific advice. We know that the overall testing figures in Northern Ireland already compare very favourably with other parts of the United Kingdom. And there are many more things that we are doing and will continue to do to support the response to COVID-19 across the community sector, in the care home sector, and across our hospitals. I also want to reiterate that what the Minister has said about the extent of the support being provided for care homes and their residents. That is a lot more than about testing. Testing is a vital part of our response. There is much more that is already going on and has been going on for many months in terms of training, support, the provision of personal protective equipment, and enhanced infection prevention and control. And I want to put on record my sincere thanks to those dedicated and committed staff working in the sector. The really hard work has only just begun. In our care homes, in our primary care settings, in our hospitals, across the wider HSE family, the fight back must continue every day. And you and I need to work together to look out for each other and to protect each other and to work in lockstep to ensure that we don't get into a situation where we see rapid increase in transmission of this virus with all of the associated consequences. Thank you.
Minister, Chief Medical Officer David Young from PA Media. Two-part question, if you don't mind. First of all, you mentioned the intention to expand testing in care homes. Could you outline a few more details in regard to that? Is the intent to test all residents of care homes? I think you gave the figure of 25% have been tested so far. So is it the intent to test all residents and all staff? And if not, why not? And secondly, just in regard to this recurring point about the dates and the lack thereof in the plan. There's a sense that I know from a lot of businesses and a lot of people in the public that they get the fact that this is subject to change. They get the fact that coronavirus doesn't respect dates, but they would still rather have had some indication, some target to work towards, knowing on the basis that that may be subject to change, rather than having nothing at all. And does the executive run the risk of not giving the public enough credit to understand that, by not giving them any information at all to work upon in terms of what they're facing in the weeks ahead?
David, in your second question, first, as the Chief Medical Officer said, this virus doesn't respect our calendar. This virus doesn't tell the time. This virus kills by day, by night, on every day of the week. So we have to set our plan and our recovery plan in the expectation on how this virus is active in Northern Ireland. And we set out very clearly the 5 steps and how we were going to control transmission, protect our healthcare capacity, out of the necessity of taking actions at the right time, proportionality of the actions that we were taking, and also remaining always cognizant of the resilience of the evidence as to where the virus was. So by not putting in a calendar, my belief and our belief, and it was at Health's request and Health's drive, that we didn't put a timetable into this plan, and that was supported by other executive colleagues, because what we didn't want to do was to build hope that would encourage apathy, or deliver a direction of travel that would encourage complacency. So it was about taking the right steps at the right time based on the 5 steps that the executive laid out. So in regards of setting timetables and leading possibly to false expectation that could lead to complacency, that would take us back as a health service to a place where our health service could not cope with a sudden rise and a sudden spike in the number of positive cases of coronavirus and people needing hospitalisation. So by not putting a timetable that would be subject to change, and then would be subject to challenge, and then would be subject to criticism, I actually think the 5 parties in the executive, when they made that decision, made a very bold decision and a very leadership-like decision in not doing that, because they left themselves open to the criticism that we've seen today. But we did it for the right reason, because we were taking the decision that we would base our steps on when it was the right time to do it, and not by laying out a calendar. In regards to the testing in care homes, the Chief Medical Officer will cover the detail of that. But it's what I wanted to make clear, and that's why I gave out those figures. We've already been testing in care homes. The perception being laid by many was that we hadn't been, but we've tested nearly a quarter of care home residents already. So in regards to the number of homes where we have positive cases at this moment in time, 75 homes where we have positive outbreaks of COVID-19, and I think off the top, I think it's 36 that have suspected COVID, where will be the initial testing target for the Northern Ireland Ambulance Service and those 40 nurses as well. But what we also have to be cognizant of is the 26 care homes that have actually closed down outbreaks as well. So the work has been going on in our care homes, so we've got to a stage that we're actually closing out COVID outbreaks within those homes. That has been supported by testing in those homes, but also been supported by the work of the care home owners, the staff within the care homes themselves, and also supported by Trust and HSE services. Michael, do you want to?
Yeah, thanks, David, for your question, and Minister, thank you. I think Minister just made a very, very important point. It appears at present that we are seeing more outbreaks being closed in care homes as the infection has gone away, and that doesn't just happen. That happens through intense effort from the care home staff, through the appropriate use of PPE, by good infection prevention and control, by keeping residents in their rooms and away from communal areas whereby there might be sources of spread of infection, by deep cleaning in the care home setting, and a range of interventions, all supported by our public health agency staff, the health protection teams, the infection prevention control nursing teams, and by our trust teams, supported by community teams and district nurses, and now, as the Minister has announced, by Northern Ireland Ambulance Service in terms of testing and providing mobile testing units. Now, that work has been going on for some considerable time. We have moved early to introduce testing of all new admissions, whether from the community or discharge from hospital before they enter into care homes. We moved to ensure that individuals moving into those settings would be isolated for a period of 14 days to ensure that there was no introduction of infection to the care homes. We produced guidance and worked with the sector to ensure twice daily symptom checks for residents in care homes. We initially moved to test those homes which suspected outbreaks, and then moved to test all staff and all residents with confirmed outbreaks. And we're now looking back towards those care homes that had previous outbreaks with a rolling, expanding programme to test other care homes. Now, what I think is vitally important in all of this is that we need to, as Minister said before, be guided by the science and by the evidence. I've said before, it's important that we use our testing capacity intelligently. There are many different settings that we need to test. I mentioned previously the importance of community surveillance in terms of general practice and our emergency departments, and looking at admissions into hospitals for either cancer treatment or renal treatment, those coming in for elective surgery. So there are steps to increase and plans to increase our testing capacity, but it is important that we use that testing capacity in an intelligent way, and that, as Minister said before, we do so when we can sustainably deliver it. Because there is little point us carrying out tests if indeed we cannot turn around the results of those tests rapidly to ensure that it informs the management of individuals in care home settings or in hospitals or those individuals that are at increased risk. Testing has always been and always will be part of the solution. And I think we do compare, as I've said earlier, very favourably with other parts of the UK if you look at our testing rates per 100,000 of the population.
Good afternoon, gentlemen. Tracy McGee, UTV. Health Minister, there are currently 80,000 people shielding in Northern Ireland. Is it the intention to extend that period of shielding? And a question for the Chief Medical Officer, R is sitting, we're told, at 0.79. Now, it's been sitting around 0.79 to 0.9 for a couple of weeks now. Why is it still so high?
Tracy, in regards to the 80,000 who are currently shielding, the advice still stays that they remain shielding. The Chief Scientific Advisor spoke this morning about the possibility of extending that shielding period, and that's something that we as an executive will look at when that advice and guidance comes forward, and when that initial period of 12 weeks comes to an end. Because one thing that we must do is, when we ask someone to shield, it's not about removing themselves from the community. It's not about taking themselves away from their family or loved ones. It's about shielding them from the virus itself so we can protect their lives and support them in doing that. So there's a role for the wider executive to play in regards how do we support them in regards to the food boxes, making sure community pharmacy is still able to deliver. But it's also about looking where we are on our stepped programme to see those who are shielding can be obviously given additional support or access to loved ones or family members, even should it be on a closed number of individuals. But we're not there yet, and that's the important point to take, and that ties in, well, I think, with your second question in regards to R, which I'll ask the Chief Medical Officer to.
Thank you, Minister. Thank you, Tracy, for your question. We need to bear in mind that the estimates of the R number are just that and have a range of confidence intervals, as the Chief Scientific Advisor has advised. And as he has provided commentary on, it has stayed relatively stable at between 0.8 and 0.9 and now estimated at 0.79. We estimate the R number each and every day, and it has remained around that figure for the last number of weeks. There isn't an absolute figure we're attempting to reach in terms of R. Clearly, we want it to be as low as we possibly can, and what we will need to do then is to continue to track it if and when we relax any of the current measures that are in place, because what we can't allow to happen is that our number to go above 1. But the confidence intervals around the reproductive number are in the region between 0.64 currently and 0.94. Our R number is broadly similar to the rest of the island of Ireland. So in the Republic of Ireland, their R number is in and around the same figure. The virus has behaved a little differently in different parts of the United Kingdom. You will have heard colleagues in Scotland expressing concern that they think their R number is a little bit higher than perhaps in the northeast or indeed south west of England, and you will get geographic variation. If indeed we were to continue the current measures that we have in place, it is likely that the R number would fall in the coming weeks. However, we need to set that against the detrimental impacts that the current measures are having on people's health and well-being, the impact that the Minister said about the services that we have paused that are also having consequences for the population. So it is important that we keep the R number as low as we can, whilst recognising that the Executive's commitment is that we look at the 3 pillars. We look at the impacts that the measures are having on health, make sure that our health service remains able to respond. We look at the impact on the economy, because again, good employment is good for our health, and that we look at the impact on wider society. And there are a lot of families, Minister alluded to some older and very vulnerable people who are now separated and have been separated from family, from grandchildren for quite a significant number of weeks. And as Minister also has said, we have a responsibility to ensure that we continue to protect those individuals, particularly when the virus is out there and circulating. Because I've said before, this virus hasn't gone away. The peak that we have seen is a peak we have created. It's an artificial peak and has come down because of the steps that we have taken. Otherwise, the virus would just continue on to infect the same number of people in exponential growth. So that's why it's so crucially important that we continue to keep that reproductive number below 1.
Good afternoon, Minister. Good afternoon, Dr. McBride. Enda McLafferty here from the BBC. First of all, to you, Health Minister, you say, are you telling us today that it will never be the plan to test all residents and staff in care homes? Because that's very much at odds with what the Deputy First Minister wants to see in all of this. So how do you feel about her intervention around all of this? And will it always be the case that we will not be going down that particular road? And then just a question for Dr. Michael McBride. Boris Johnson was asked today about a comment by a senior medic who talked about the fact that there were cases in the past before the proper testing mechanism was put in place in care homes where people were moved from hospitals to care homes without being fully tested, and the suspicion is that they brought the virus with them. Can you give us, I suppose, an undertaking that never happened here in Northern Ireland, that was never the case, that was allowed to happen here? And just as an add-on to that, Nightingale Hospital now being stood down, can you tell us just at its peak, how well was it used essentially percentage-wise?
Enda, thank you very much. The Nightingale, I'll start with your last question first. You know what, at one stage we had over 30 occupants in ICU beds in the Nightingale when it was operating as a regional unit. So when at our peak, when we had over 50 people being in ICU beds and being ventilated, the Nightingale was one of our key strategic tools for tackling COVID-19 and making sure that patients had the appropriate support they needed. And it was a concerted effort across Northern Ireland, and it worked well. And that's why when we say we're standing it down, we're not doing away with it. It will be there should we have need of it again. But I think it was a testimony to all trust staff and the staff involved that they came from across Northern Ireland to support it and to work in it. So I think it's a testimony to the work that they did that we're able to bring it down. In regard to your question on testing in care homes, what I've clearly said today here is we're increasing our capacity in care homes. That'll be done by teams from Northern Ireland Ambulance Services, 40 nurses, get in and starting with those homes where we have suspected outbreaks. And as the Chief Medical Officer said, then moving into a programme of the homes where we have confirmed outbreaks. Now, when we're doing the number of tests that we hope to be doing, we should quickly move through all those homes that either have suspected or confirmed cases. At this minute in time, we will then move when testing capacity increases and gives us the capacity to increase and test in the homes where there are no COVID-19 outbreaks. While there are no outbreaks in some homes, we think it is better to maintain those homes in the way they are rather than to introduce any further outside influences. But as soon as we see somebody becoming symptomatic or asymptomatic or a staff member needing testing, that testing support will be there. So I think what we're seeing, and I've had this conversation with the Deputy First Minister, I don't think we're at odds in our intention. I think there's a difference maybe in language, and I think where she talks about universal testing, we talk about a rolling testing programme. So our aim is the same, and that's to drive down the number of COVID patients who are currently in care homes at this minute in time, using testing as one of the key aims, but also supporting the staff to make sure those residents are getting the appropriate care and attention that they need, so we can tackle this virus where it's particularly rampant in this minute in time.
Thank you, Minister, and thank you for your question. I think just to build on the Minister's point, we have a significant proportion of our care homes, indeed, again, compares very favourably with other parts of the United Kingdom that have not seen outbreaks of COVID-19, and that's the way we want to keep it. So as much effort is going into keeping those care homes COVID-free as to managing effectively and efficiently and providing all the necessary support to those care homes that have current outbreaks. In terms of your specific question about the routes of entry into care homes, I think it's difficult to answer that question with any degree of certainty. My personal view, again, we would need to look at it in some detail, is that more likely route of infection into care home is from the community. We know that the movement of staff in and out of the care home sector, no matter how committed and dedicated staff are to the use of personal protective equipment and everything else, and infection prevention control, this is a highly transmissible virus. The enemy here is the virus. Testing is an important part of that, and again, what we did was we moved to introduce testing of all new admissions, whether that was those being discharged from hospital or those being admitted from their own home or supported living. And we've now also extended our testing to all of those who are in supported living. So we are rapidly scaling up our testing. So I think the answer to your question, I think the more likely route of infection into care homes is undoubtedly from the community, introducing the infection into the care homes. Because don't forget, these individuals, as the Minister has said, are the most vulnerable in our society, very frail, often with severe underlying health problems, and they require day and daily assistance with the activities of daily life, the things that you and I take for granted, and that requires very close, very personal care and support. And with that comes risk. It's impossible to social distance in a care home and provide the level of care and support that the individuals there require.
Afternoon, Nigel Gould, Downtown Radio and Cool FM. A couple of questions, if I may. First one to you, Minister Swann. It's clear, if it wasn't already, the COVID battle is now very much concentrated in the care home setting, as you've alluded to there. Wondering if you could give us an update on the number of nursing staff who've been redeployed from trusts to date into care homes, obviously outside of the additional ones for testing you've just announced. And at present, do these homes have separate teams looking after COVID and non-COVID patients? At the same time, are you able to update the picture with regards to staff absence rates as well? And a second question to CMO, just wondering, Dr. McBride, nearly a couple of months into lockdown now, what additional information do you now have about this virus? Transmission, I'm thinking of, for example, can it be caught over and over again? Is there anything you've learned, or are we still somewhat very much in the dark in this area?
Okay, now in regards to the support going into care homes, that's managed by the RQI. I don't have specific figures in front of me, but I'm aware of one care home in the Belfast Trust that received the support of up to 40 additional staff from the Belfast Trust. Another home in the Northern Trust area that received the support from 27 additional staff from the Northern Trust area. So there are those homes who are receiving large commitment and large support from trust sector staff as well. But there's also those homes who are able to manage with their own staff because of the protocols and the setups that they have there. But when they do need that additional support, they are getting it from the trusts as well. In regards to staff absence, in regards to our own trust staff, at this minute in time, the latest figures I had, we had in the region of 250 trust staff members across Northern Ireland. That's out of a workforce of over 70,000 who were off with COVID positive tests. So compared to the rest of the UK and our Republic of Ireland colleagues, it's quite an impressive level of staff absence. Of course, every member of staff who has contacted COVID-19, it's a regret that they have, but through the work of their infection control teams and the PPE, we've managed that number to quite a low number. And I wish them all a speedy and full recovery. We have a number, I think the last I seen was in the region of 1,600 staff who were self-isolating. Now those would be staff who would possibly be in receipt of a shielding letter. So it may not because they are COVID positive, but because of self-isolation requirements or instructions they are. So look, in the region, if I remember, it was about 2.5% of our overall trust staff are currently off either due to COVID or COVID self-isolating. So I think for the commitment that we've seen from our staff members, from the support that they've got from their management and the infection control teams in the hospital, it's an achievement and something that we could work to make better, but we've done a lot of work to making sure that number is as low as possible.
Thank you, Minister. Thank you, Nigel, for those questions. I think I would make a general comment first and then maybe 3 points. Firstly, the level of international collaboration that has been going on to understand more about this virus, to share that information, has been phenomenal. We are seeing the publication of research in advance of it being peer-reviewed, so that information can be disseminated rapidly right across the world. In terms of the virus, I sometimes pinch myself and have to remind myself that it was only at the end of December of last year that this virus was known to anyone outside of China and recognised. And by early February, we in Northern Ireland were one of the first UK centres testing for the virus. We rapidly learned a lot more from other countries and the international experience about how the virus was behaving. In the very early days, you'll remember, we didn't know how transmissible it was. We didn't know what the case fatality rate was. We didn't, in those early days, know that those who would be most vulnerable and most at risk. What we have done since that time is we've gained a huge amount of experience in terms of the best clinical treatment. Now, most of that treatment to date has been supportive treatment, supporting people who get more severe disease, respiratory support, ventilatory support, renal dialysis for those who get the more severe end of the spectrum. But we're also learning much more about some of the unusual manifestations of this disease, some of the rare manifestations, and that learning continues. And we've also are part of international trials and trials across the United Kingdom in terms of optimal drug treatment. Because again, I think that's the first ray of hope we will see will be treatments, particularly for those hospitalised patients, that will prevent the need for them to go on to require mechanical ventilation. And there is rapid progress also being made in relation to vaccines, and again, particularly here in the UK and in other European countries. The most important question that you've asked, and the most important question that is one that I struggle with and want to know the answer to, is your point around immunity. We don't yet know the degree to which immunity occurs following exposure to this virus. None of us have met it before. The only one of us who've met it before are those who've been exposed to it, infected by it. We don't yet know the extent to which that will confer immunity to reinfection. And for those who do develop antibodies, we don't know how long those antibodies will persist and whether or not they will protect against future infection. Now, that's vitally important for a variety of reasons. We estimate that somewhere in the region of perhaps between 5 and 20%, so that's a very low percentage, and it varies by region, and I suspect we're towards the lower end of that, given the spread of the virus in Northern Ireland has not been as extensive as elsewhere in the UK, for instance, as in London. I think a very small percentage of the community in Northern Ireland have antibodies to the virus. How long those last, whether they're protective or not, I unfortunately don't yet know, but we're working very hard to get answers to those questions, because again, we know that the production of antibody will be an important indicator of how easy it will be to develop a vaccine, because that's really the prize. The prize will be a vaccine that will stimulate the immune system to develop two types of immune response: antibody, neutralizing antibodies, which neutralize the virus, but also cellular immunity, which gives us the surface resistant to exposure to the virus. In terms of reinfection, there is no significant compelling evidence that at this time that you can acquire this infection again. There has been some reports and concerns initially about that. Those have been largely based on the very sensitive PCR test, and we do know that the PCR test is basically a finger. It's a fingerprint test for the virus, and the RNA from the virus can persist for quite some time in respiratory secretions, even after the infectious virus has absolutely disappeared. But that, if I knew the answer to that question, I would probably sleep happier in my bed at night, because it would reassure me that those people who had been exposed would not get the infection again, and that actually the prospect of a vaccine was closer.
Okay, thank you.